Hi there, my name is Dr. Jason Strandberg. I am the Medical Director at Lake Minnetonka Mobile Wellness, and I am here today to talk to you about latent injuries that you will experience after a car accident. Now, if you've ever been in a car accident or multiple ones, you know that not each one is the same, and not everybody experiences injuries the same way. And in many cases, you don't even feel pain right away. It's not until a few hours or a few days or even a couple of weeks after the accident that you start to notice the pain. And in this video, we're going to talk about why that is and why the most common injuries that we seem to see happen in car accidents. So to begin with that question, why is it that you don't always feel pain immediately after the car accident? And there's actually a whole bunch of reasons, but the biggest one, the number one reason is the adrenaline rush. If you've just been in a car accident, you hit something, someone hit you, now you've got adrenaline running through your body. It's a fight or flight protective mechanism that helps keep you going and helps make sure that you don't get injured any worse. In addition to that, because of the fight or flight reaction you have going on, because you're worried about protecting yourself and others, you also get a flood of endorphins and enkephalins, which are your body's natural painkillers. And as the adrenaline wears off and as the endorphins and enkephalins wear off, you start to notice some pain. Now, right away after an accident, you've got muscle splinting that's happening that's preventing you from moving your body in a lot of ways. And as that fades a bit, then you're going to start to move and find places where your body starts to hurt. On top of that, inflammation has not yet set in. You've probably damaged some tissues, and your body's first line of defense for most damage to the body is inflammation. And that is when it sends a whole bunch of extra blood to an area, because the white blood cells will help fix the damaged tissue and take away the damaged tissue. And then the red blood cells and the fibers floating around in your blood will bring collagen and the nutrients needed to make collagen to that area and starts to lay down new tissue. And this process will start within hours of your injury and will peak about 2 to 3 days later, which is why you tend to see the worst pain not right after the accident, but 1, 2, 3 days later. And some injuries can take days or even weeks because your body compensates so well for them. Now, one of the things people tend to notice earlier on following an accident is this general stiffness and soreness. It's a protective mechanism. Your body is trying to prevent you from injuring yourself more. So if you can't move your neck very far either direction, it's because the muscles are here splinting and preventing you from moving in case there is any instability in your joints. Now, on top of that, we talked about this inflammatory response where the blood rushes to an area and starts to cause redness and heat and then eventually swelling. And the swelling and the chemicals and the inflammatory response actually trigger pain mechanisms inside the muscles and the joints that have been affected. Now, one of the most common things that we see following a car accident are headaches. Now, there's a number of reasons for this. First of all, any injury that is significant enough to cause neck pain, so the whiplash, the hyperflexion, hyperextension, sudden start-stop mechanism, that's going to definitely cause problems with your neck, but anything that can injure your neck can also injure your head, and the brain inside your head could be striking the walls of your skull, and that could lead to a mild concussion, a subclinical concussion, and one of the long-term effects of that is headache. But the whiplash mechanism itself also injures a number of ligaments that help connect the vertebrae to the skull, and even some of these muscles, the rectus capitis posterior, major and minor muscles, which sometimes we collectively call the suboccipital muscles, have attachments to the meninges of your skull, of your brain, and can pull on that and can tug on the blood vessels there, which is why we often get headaches following the car accident. And obviously, if these muscles have been damaged, they're going to cause muscle pain and muscle splinting and pain there. Now, where one vertebrae overlaps another, we have what's called a facet joint. And those facet joints can also cause pain if they are slightly offset. They can actually irritate each other, and they can possibly pinch the nerve that's coming out of these little openings between the vertebrae. So those facet joints themselves can be malpositioned, they can be compressed, they have sensory nerves in them which can be irritated by this whole process. And they're also surrounded by joint capsules, which in and of themselves can be irritated and cause pain. All of these ligaments can be damaged. And you can see here the anterior longitudinal ligament running down the front of the spine, then down the back of the spine. Our vertebral bodies is a posterior longitudinal ligament. On the inside, there are things like right here between the spinous processes is the interspinous ligaments, the ligamentum flavum running on top of it, and then this big ligament connective tissue group called the nuchal ligament. All of these things can be injured in a car accident and torn or partially torn, which is what a sprain is. And the muscles, when they're partially torn, not completely, but some of the individual fibers are torn, that's a strain. So all of this can happen. And then in the really bad case scenarios, in between your vertebrae, there are discs which act as a cushion for the vertebral bodies on top of each other, and also act as a spacer so that these spaces for the nerves to come out are there. Well, if this disc is injured enough, it can be compressed. That space for the nerve to come out can be shrunk a little bit because of that, but if it also bulges outward toward the side, it can press on one of the spinal nerves coming out, or if it bulges straight back, it can press on the spinal cord itself, and that has a whole bunch of other symptoms that it's going to cause. Shoulder injuries. Why do we get shoulder injuries? Well, your shoulder is probably one arm, if you're driving, is forward from the other one, or maybe both of them are going forward, and you were just hit from behind, from the side, whatever direction you were hit. The seatbelt in and of itself can cause an injury. So if you're the driver, it's more than likely that your left shoulder is going to be injured. But if you're in the passenger seat, it's more than likely that your right shoulder is going to be injured. If you are looking sideways when the impact happens, now the muscles that connect your neck to your shoulder girdle can be injured, and that can also cause shoulder injuries. Anywhere from this sternocleidomastoid muscle being injured and pulling up on the clavicle to rotator cuff injuries. And then side impact injuries obviously will throw you either into the door or toward the console and can again cause a number of problems that we don't necessarily think about. Chest pain. Following a car accident, the biggest reason why we end up with chest pain is either the airbag deploys and just runs right into our chest, or if we didn't have an airbag deploy and our seatbelt didn't catch us very well, we could actually have your whole chest run into the steering wheel and make a big impact. The seatbelt itself, again, it's coming across your body, so it's going to cause this part of my chest to go forward more than this part, and that can cause subluxation, dislocation of the ribs. It could cause a broken rib. It can pull these little muscles in between the ribs called intercostal muscles, and it can also cause irritation of this connection where the ribs connect with the sternum, and when that happens, it's called costochondritis, and it can cause stabbing chest pain at a very specific location, and some people even mistake it for heart attack pain, but it typically only exists when you move your shoulder or chest in such a way, or when you take a really deep breath, whereas the heart attack pain will be constant. Lower back pain. Why does the lower back get hurt in a car accident? You're sitting. It doesn't generally move a whole lot. Well, it doesn't need to move a whole lot because remember, just like in the neck, we have these ligaments in between each of the vertebrae, which can be damaged with a quick movement or tear. And we have the tiny little muscles that run from vertebrae to vertebrae that are running both in the neck and the lower back, in the middle back. Those muscles and ligaments can be injured quite easily in the lower back and in the sacroiliac joint as well, and that can lead to the lower back pain. Lumbar disc injuries, especially between L5 and the sacrum and between L4 and L5. Those are the most common areas we see disc herniations here. And again, that disc herniation in the lower back, just like the one in the neck, is going to press on the spinal nerves coming out. In this case, instead of sending numbness, tingling, pain, or weakness into the arm, it's going to shoot into the leg. The facet injuries, this picture actually does a much better job of showing the facet joints, where the inferior process sticking down from one vertebrae meets the superior process from the vertebrae below, and then they overlap, and this is what that surface of that joint looks like. What you can't see in this image is that it's just lined with tons and tons and tons of nerve receptors, both for pain and for spatial relations. Now, one common thing that we will see following car accidents is sacroiliac dysfunction and hip flexor injuries. And so quite often they're related to each other. The most important hip flexor that you have in your body is called the iliopsoas muscle. And it's a mix of two muscles, the iliacus muscle, which actually originates up here in the middle to upper lumbar vertebrae, and comes down and meets up with fibers that are coming off of the inner part of the iliac crest, and all of them come through and wrap and attach to the upper part of the femur. Now these muscles together, the iliacus and the psoas, or the iliopsoas muscle as a combined muscle, are responsible for hip flexion. Now when you are sitting in the car, your hip is already flexed at 90 degrees. And if you have an injury that causes splinting, that iliopsoas is not going to want to relax, and it's going to keep your hip intentionally flexed. So even when you try to stand up, it's going to mess with your lower back and your psoas muscle. Now, what help can you have and find for lingering pain following an auto accident? First of all, if you've been in an auto accident and you're feeling any pain, get examined by a licensed healthcare provider. Do not Google it. Do not look online and say what's going on. Go to the emergency department. Go to urgent care, or go to a chiropractic office or an orthopedic urgent care center. These are the best places to go. Emergency departments, orthopedic, urgent care centers, chiropractic offices, they tend to be the ones who will be able to x-ray you, examine you, find all the different things that could have gone wrong, and get to work on it right away. Now, that being said, if you have lost consciousness, you need to go to the emergency department. If you have not lost consciousness, then the orthopedic urgent care or the chiropractor's office may be the best place to go first. Regardless, you need to get examined by somebody who knows what's going on, that they can check you for the concussion, they can check you for potential internal bleeding, they can check you for broken or dislocated bones. Once we've ruled out dislocation, fracture, and internal bleeding, or if we've discovered them and we need to take care of them right away. Once we've done that, now we look at medication, pain medication, to deal with the immediate pain. That could be ibuprofen or Tylenol. It could be non-steroidal anti-inflammatory medication. Again, ibuprofen or aspirin works very, very well. Naproxen. We might be looking at muscle relaxants like Flexeril that will help you not have all these spasms and give you a little bit of range of motion left, and let the other healthcare providers get in there and do the work they need for you to get better. Chiropractic and osteopathic manipulation. Manipulation relieves pain following car accidents because it helps to line those joints and put them back where they should be. And also helps the healing process work right. If the joints are lined up where they're supposed to be when the tissues that are being laid down are being laid down, they're less likely to leave one muscle on one side too tight and the other one too elongated. This will allow you to be lined up and allow your muscles and ligaments and tendons to heal appropriately. That being said, if you are getting your spine manipulated, please do not go to a physical therapist who has been trained in it. Do not go to an MD who has been trained in it. Find a chiropractor or an osteopath. They have been trained for years, not weeks, not a weekend seminar, for years on manipulation of the spine. There are differences to the techniques, and there are reasons to use either one. I use both in my practice, but find a good chiropractor, find an osteopath who does manipulative medicine. This is necessary for a quicker and more complete recovery. Now, that being said, the problem with many chiropractors is they will come and they will do their manipulation on you, and they'll slap you on a electric stim or on a massage table and leave you be, and they'll have you come back over and over and over again, and you'll feel good for a few hours, maybe even a day or so, and it'll come back. And you'll say, why? Well, part of the issue is you also need to add rehabilitation. Physical therapy, occupational therapy, a good chiropractor, an osteopath who's trained in rehabilitation, all of them can set you up on an exercise program that will get you better quicker. Do not go to the personal trainer for this one. Do not go to the personal trainer. They're good at helping you lose weight. They're good at helping you add muscles on. They are not trained to deal with significant, especially acute or subacute injuries. Now, the rehabilitation should include stretches that help improve your range of motion and strengthening exercises. Now, again, this is not the stuff necessarily the stuff you will do at the gym with the pull down lat pull downs and all of this other stuff. That might be part of it, but we need to be able to isolate the muscles that have really been damaged and work on those individually. And that is why you need somebody like a physical therapist, an occupational therapist, or a chiropractor or DO who does rehabilitative medicine. Acupuncture can actually be an amazing part to the relief of pain and inflammation, and it even helps encourage healing of muscles and ligaments and tendons, and definitely helps with the inflammatory process. And in fact, it is listed on the World Health Organization. Those are all indications for the use of acupuncture. And in our practice, it really helps. There are some physical therapists who will do what they call dry needling. That's basically acupuncture without the Eastern theory of acupuncture. And in this case, that is just as good. You'll get some acupuncturists who might argue with me on that, but dry needling will help you if it's done by somebody who knows what they're doing. Massage therapy. Massage therapy can be a very important part of the accident or the healing following an accident, and we use it quite often in our process. Now, this is not the massage therapy that you get at a salon when you're on vacation and just want to feel good. This is deep tissue. This is sports massage. This is the stuff that is going to tear apart some of those adhesions, and it's going to hurt while it's done. They're doing it, but it's going to feel better. That's the type of massage that you need, because that will prepare you for healing, and it will help you get through these exercises and the manipulations and the things like that that are going to help you improve. Injections, whether it be steroid injections or lidocaine injections or other prolo injections, all of these different things are options in the treatment of car accidents depending on what's going on. They can be very helpful for disc herniations, for facet injuries, and such. And trigger point injections can help massively with pain relief, as well as allowing that PT or that chiropractor to get in there and do the exercises with you that are needed and the stretching that is needed for appropriate rehabilitation. Now, if all of this stuff fails, or if you're at some point where you have lost sensation or enough muscle strength that it's a concern of that licensed healthcare provider, surgery may be necessary. Surgery could be done to help herniated discs. Surgery will be done if there's internal bleeding or other things. Surgery may be necessary with broken bones. Sometimes it is, sometimes it's not. But again, this is why you need to go to a licensed healthcare provider early in the process and have it evaluated. And last but not least, what can be done? Find an ethical, aggressive attorney. You were in a car accident, you were hurt. The car companies don't have your best interest at heart. They have the stockholders' best interest at heart. We work with a number of attorneys. We do not get kickbacks from them. We do not give them kickbacks. We just work with people who we know we can trust, who put the patient first, the provider second, and themselves. Know that if they take care of the patient and they take care of the providers, that they will be taken care of as well. So you need to find somebody who will do that, and they're probably not the people who are paying the most money for those giant billboards. We tend to work mostly with the small boutique shops. We do work with a couple of larger firms, but not the behemoths who are out there spending tens of thousands of dollars on advertising all the time. You want to find that person that's going to treat you well, treat you as not just a case number, and they're not going to try to close the case out as fast as they can so that they can get on to the next one. Like I said, I'm the medical director at Lake Minnetonka Mobile Wellness. We're a multidisciplinary medical group that works sports medicine, rehabilitation, and performance medicine. So our goal is to get you better first and help you improve your performance, keep you going, and make you get even better once you're healthy. We focus on not just being out of pain, but how can we help you sleep better, move better, do whatever it is that is important to you better. And we have chiropractic, acupuncture, medical, massage, rehabilitation. Our MDs and DOs do primary care, pain management, anti-aging medicine, sports medicine, referral to partners in every aspect of orthopedics, neurology, rehabilitation, sports medicine. You name it, we have people that we work with either in our group or just outside of our group. And we will get you connected. So if you've been in a car accident, give us a call. We can be found at LakeMinnetonkaMobileWellness.com online, or call us at 952-222-7886. And we will set up an appointment where we come to you and visit you, if that is the most convenient. We come to the home to treat you. We do telemedicine, in addition to having clinic space in the Lake Minnetonka area. If you were in a car accident, we will even come and give you a free 20-minute neuromuscular massage supervised by one of our docs, oftentimes even performed by one of our docs, and evaluate your situation, tell you what we should think would be the best treatment for you. It will cost you nothing out of pocket, and in fact, most of the care for car accident victims is covered by automobile insurance with little to no cost to the patient because of Minnesota no-fault injury laws. So again, if you have any questions, give us a call, 952-222-7886, or find us online, LakeMinnetonkaMobileWellness.com.